This is my second video on hip, knee and ankle stability. So this assumes that you've done the first one and that you found it easy and that you have really got the good quality hip stability and weight bearing through your hips. So this is a progression. Don't do it if it hurts. Don't do it if you feel unsafe, and check with your practitioner if you want to make sure that these exercises are right for you. Now I'm just going to start with a warm-up and just the heel toe, so just running on the spot. As with all these exercises, we're going to go for stability first, and then we're going to add in agility and flexibility and trunk rotation and different actions. So you really want to make sure that you've got the balance through your body evenly and the stability muscles working before we add in the extras. So again, I'm going to drop my arms and look at the white space between my arms and my waist and make sure that I'm not letting that hip go to one side, which is my tendency to do. So pulling it up tall, pulling your whole body up tall from the back of your head, chin comes in, and I'm not moving the top part of my trunk much at the moment. If I go sideways, you'll see it's just a heel toe action like this, loosening up and hip steady. Now I'm going to add in a little bit of rotation. So a little bit of a running action. And even though it doesn't look like you're doing very much, just working on making sure that you don't lose that hip stability and just get the rotation going through that way, like rotating that way, not that way. So loose, and we'll be ready for the next set of exercises. If you have any problems with stability, it's really important to make sure that you've got full flexibility in the sideways movement. So taking me as an example, with my tendency to do this, it's a little bit stiff doing that. So a good way to make sure that you've got full flexibility is feet about a foot away from the wall. I'm now leaning my left shoulder in and my left elbow, and I'm using that elbow there as a pivot point. So I'm going to move my hip very slowly sideways, not too hard and not too fast, because as I said, I have a tendency to go that way. It can really feel very uncomfortable for me to do that stretch too quickly. 3, 2, 1. Short of pain. You don't want to feel pain while you're doing it. It's better to do it little and often and gradually build up. Now I've got my feet about a foot away, so I'm going to turn my back to you. Put my shoulder and my elbow the other way. Put the same distance. Elbow tucked in. And I'm going to have a lot more movement on this way because my hip favours that movement. So I can benchmark that and think I'd like to end up getting as flexible to this side as I am to the other. Again, it's better to work that flexibility over weeks, not try and get it in one day. Okay, so we're doing the calf loosening up exercise. Start with your heels together, toes together, and as you step forward, make sure that the back leg doesn't rotate outwards, which is such a tempting thing to do. Touch if you need it, but we're obviously aiming for balance here, so as you get better at it, I prefer you not to touch. Look at your hips and make sure that, unlike mine, you haven't got that tendency to go to one side. So I'm trying to correct for that and working my stability hip muscles, and I'm now going to turn sideways so you can see. You'll see my back heel is just lifting up very slightly as I do that. This time I'm going to look down and make sure that my knee is going evenly over my toe without a wobble side to side in my knee. So the problem can be with knees is they'll rotate in or wobble, and what you're trying to get is that stability going there. So looking up again, look at your body. When you feel that this is easy, when you've got nice evenness through your hips and you've got your knee over your toe and your stability working well, you can make this exercise a little bit harder by going back and up and back. Touch if you need to, or not, get away from the chair, and up and back and up and back and up. And just 5 on one side, 5 on the other. So pretend I've done 5, 5, 4, 3, 2, and 1. Knee bend as you come up, knee straightening. In this exercise, I'm going to practice keeping my knee and my ankles steady and stable while I rotate my trunk. So I'm putting the weight onto my right side, shifting my right side, weight sideways, touch lightly just for balance. I'm just going to do the old toe on the ground, just so that I can be on one leg but my toes very close just in case. Bending my elbows into 90 degrees so that I can see how far I'm rotating. I'm going to keep my head still and just rotate my trunk like this. So it's the top part of my trunk that's moving, but my knee and my ankle are keeping solid and stable, and my toe is just there just in case I wobble too much. Now if you can, up higher with the toe off is good. I'm going to change sides, so weight goes over onto the left, my right toe touches the ground just slightly behind, ready to catch me if I do start to wobble. Arms bent just so I can look in the mirror and I can see how much I rotate without pain, so there's no pain in this. My knee and my ankle are holding, hopefully, fairly steady, and my trunk is rotating on the top. And if I can, I'm going to take my foot off and keep everything down below steady while I rotate the top part. I'm only going through about 30 degrees. I don't really need my arms there now. I can just get that rotation without my arms. In the first video, we did some knee bobs like this, and we're just trying to keep your hips over feet. If I turn sideways, my back is straight, and I suggested that you might want to do that against the wall to make sure that you didn't lean forward. That was that action there. And knees over toes, hips level. So just doing that as a warm-up. Now what we're going to do is make it harder by putting the weight onto one leg, the right leg, take the left leg back with a toe touch, pull your hip up tall, you're up tall, and just doing some knee bends. And again, keeping your knee over your toes. 5, 4, 3, 2, 1. Cheating. And just go over to the other side and toe back. Bring your hip in tall and gently up and down like that. Now, ideally, you'd be wanting to do it without any prompts from your toes or fingers. But if you find that you're starting to lose it, back to the touch, because you're practicing getting the quality right. There's no point in practicing it when you're like this or wobbling at all. 2, 1. So 5 on one, 5 on the other, and keep touching until you've got that perfect. In this exercise, we're just going to practice making sure that your hip is really pulling up strong. So what I'm going to do is put my weight onto the left side, just a slight shunt over, the back leg goes there, toes touching for balance. Now, just let it go. Give way and pull up. Give way and pull up. So it's practicing or training that hip muscle how to get out of that slump. So let it go, not too suddenly, not too hard, and pull up. Let it go, not too suddenly, because a sudden slump could hurt, could have you on the floor in pain. So do it slowly and gently. 3, 2, 1. And I'm going to do it on the other side. Now this is the side I tend to go to. So this is the side I need to practice really pulling up. And in it goes, and in it goes. Now, I'm not putting any weight on that back leg, so you might as well just be standing on one. That's just there to give me a little bit of support. Don't let it go too suddenly or too far. Control it, and you're just training that hip to come in on one leg if you can. Toe touching or finger touching if your balance feels a bit wobbly or you just need a little bit of extra help. Always after pain in hips and knees or after surgery, there's a lot of focus on stability, and we're going to come back to that, stability. But part of the problem, especially with cruise ship problems and the rest of it, is that the world is never going to provide a highly stable environment. You're always going to fall or find yourself coming out of a jump with your knees going sideways onto uneven ground, or even if you're just bushwalking, you'll find that you're walking on uneven ground. So your knees have to work. You have to be able to consciously make your knees work in there and run in their position of power, knee over toes, but they have to be able to cope with some perturbation. And unfortunately, a lot of people don't train that up. So it means that everything's, the gym strong, ready to go back to sport. Then the minute they hit the uneven ground, the knee or the ankle or the hip gives away. So what I want you to do just to start with is just to practice with a slight knee bend. And all I'm going to do with my back straight, because we don't want to hurt backs by leaning forward, is just roll my weight onto the outside of my left foot and the inside of my right, and then the other way, outside of my right foot, inside the left. And I'm not moving the top part of my body. It's kind of like something like a 1920s dance, I think, but I'm just getting that rolling action. So my knees are traveling away from my hips and away from my feet. And you're just doing it within pain limits, of course. If that hurts, you might even just do a tiny movement. You're just rolling side to side. If you look at me sideways, it's just that action there, just going side to side with the inside and the outside of my feet lifting up. And of course, one of the progressions that we'll do in the next video is doing these kind of things on a wobble board or something that really pushes that balance on your ankles and moves your knee around. The ability to rotate through your body and stay stable is really important. So in the previous exercise we went side to side. In this one we're going to be rotating. We're going to be rotating from the feet up rather than from the body down. So we all do lots of rotation like that. That's from the trunk down. This one we're going to do from the feet. I'm just going to show you with the pen what I'm doing. So I've got this pen at the side there and I'm going to rotate through my toes. And it's more the balls of my feet that are working, but if you can see the pen now rotating around, and if I go sideways, back straight, and it's rotating like that, in and out, not sideways, so the movement's coming from my feet up, and they're rotating my hips, and I'm actually trying, perhaps not too well, to keep the top part of my body fairly stable, so the rotations from my feet up to my waist, and it shouldn't hurt. If it does, you cut. I'll take the pen away now. It shouldn't hurt, but if it does, just cut it back to a level where you're getting some rotation through your feet, through your ankles, up through your knees to your hips, and that it doesn't hurt. Just a small one might be enough to practice to start with. 4-point kneel is a really good place to get hip stability working, but not everybody can kneel, and often that's because the skin becomes sensitive or the kneecap becomes sensitive to kneeling. Often if you've had a long history of hip, knee, ankle pain, that will happen. So the first thing to do is to massage it little and often every day so you take away that sensitivity. The other thing is to try a pillow, and that can help do the exercises without pain. It's important that you don't create pain by doing the exercises. On all fours, just start with a very gentle pelvic rock. So that's like the cat stretch. I'm keeping my chin in because lifting your head up like that can be uncomfortable, and holding that for a long period hurts. Find a position that's halfway between the round up stretch and the dip, which is sort of like about there for me. Now the stability muscle that I'm going to work is the opposite one to the leg that moves. So if I take my left leg back like this and keep my back and hip steady, it's the right hip that's doing the stability work. But value adding, I'm getting some hip mobility, and you can go further if you like, so long as you can keep your back steady, so long as it's not that movement, that's the wrong movement. So it's a very steady action like that. Change to the other side, 5 on this side. This is my more steady left hip now taking the stability, so I might want to make that harder by moving the opposite arm. So long as you can still hold that steadiness in your hip and back, and change to the other side, chin in still, back steady, 4, 3, 2, 1. Now, while you're down here, we might as well value add and get a little bit of knee flexibility going here. So loosening up my knee, going backwards and forwards. Don't force it. Never force a stretch, there's no point. You might take a few weeks to loosen up. If you try to do it in one day, you'll end up with a swollen, inflamed joint. So just gradually loosening up my knee. I've got my weight on my toes. 3, 2, 1. Now I'm going to get a little bit of a back mobility by rounding my back, tucking my chin in. 3, 2, 1. That's plenty. If you're not used to it, don't force it. Bit of ankle mobility, stretch them out gently, pointing your toes down. Good cramp potential, so just be careful. 3, 2, 1. Now I'm going to go into doing a hip stretch, so right leg forward, and I'm stretching the back of my left. Now change, and that's quite hard for the old balance, so you might need to touch the couch. 3, 2,
1.
When you're using your muscles for endurance or for power, you make sure that you're using them to your advantage. And the position of power for your big quadriceps muscle is knee over toe. So that we did the warm up with the knee over toe like that. It's always good to practice some jumping actions that you might ultimately use for a sport. So we'll start with some little warm-ups, which are just knee, toe like this, just bending and getting a bit of a jump, a little bit of a jump. I'm actually not jumping here, I'm just doing that as a warm-up. And a little bit of a spring into it, a little bit of spring, and loosening up, knee over toe, knee over toe, knee over toe. Now you progress that to an actual jump, and jump, and jump, and jump, and jump. Now if that's easy, you try to do a hop without losing your stability. And as I say to my athletes, I'm not going to be playing long games, so you have to be better than me at doing this. Other leg, jump, 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 stability, stability. The exercise that many of my guys hate is the skip, 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 and around the room. You get the idea of that one. And then add in the sort of action that you might be using for your sport. So for something like tennis and you're taking a leap that way at the net, going low at the net, you're making sure that your knee is always over your toe. And the other way, knee over toe, knee over toe. If you're catching at cricket, it's the same. Down low, knee over toe, down low, knee over toe, down low, knee over toe. And usually if I'm training somebody, I might throw a ball and they won't know which way it's coming, so it's down, maybe in that way again. And it's good to get somebody to do that to you. If you're going to be playing rules, you need to be able to practice the mark, which is up, land, stay tall. Up, land, stay tall. If you're going to be doing netball, it's land and step. Land, one step. Land, one catch and step. So you know the sport that you're playing, you just have to add in the exercises that are going to be right for you. In order to regain stability, you can't neglect your flexibility and the ability of your muscles and joints to move freely. Sometimes it's best to do these exercises after you've done all your mobility work, and that helps warm up the muscles and loosen them up, and you get more out of them, so that you move in order to stretch, don't stretch in order to move. And think about it as relaxing the muscles, regaining movement, easing it out, not stretching and straining it out, which can have exactly the opposite effect, that if you go too hard, too fast, the muscles can react and tighten. So I'm just going to lean against the wall, put my weight on my left side and bring my right knee to the chest, give my hip a bit of a bend, my hip muscles are working, my hip joint. Now I'm going to put my hand on my heel, or my shin, bring my heel to my bottom to give my knee some flexibility. Work 3, 2, 1, don't force it. You'd be better to perhaps, if it feels at all uncomfortable, just soothe it up, just like that, gently easing up. 3, 2, 1, put my hand on my shin and bring that in. Heel into bottom. 3, 2, 1, but if that hurts, just gently do it. Now again, these are presuming that your balance is good enough to do them in standing. You can do exactly the same exercises in lying if your balance isn't that good. I'm now going to, I've got my feet a little bit away from the wall. I'm going to bring my right knee up, and I'm going to use my stability muscles in my pelvis, my core stability muscles, to hold my waist against the wall or near to the wall, and gently bring my knee up and over. That's stretching a little muscle called piriformis. Don't put too much pressure on it, just soothe it out, ease it out. It's a little muscle called piriformis. You can feel that either deep underneath the gluteal muscles there, or you can feel it in the groin. Again, you don't want to feel it really, you just want to feel it, an easing, relaxing movement going up and over. Feet a bit away from the wall, other side, waist stays to the wall. So I'm not rotating my whole body, that was a bad demonstration. Just keep your waist on the wall, soothing it up, and just till you feel a little bit of a kind of a tightness here or in the groin, but not pain. 3, 2, 1, and relax down. While you're against the wall, you might want to stretch your rectus femoris, which is the long quads muscle. So grabbing hold of your heel, knee back, keeping your knees in line together. 3, 2, 1, and starting with my knees touching, then just taking the other one back. 3, 2, 1. Now the hamstring stretch, you might want to do that just on the ground like that. 3, 2, 1. If that's easy, go for a low couch. Don't do this at home, kids, on mum's couch, but this is a physio couch. So I'm arching my back, leaning forward slightly. 3, 2, 1. If that hurts, go back to doing it on the ground like this, bending the knees, so it's also a good stability exercise. Arching forward. 3, 2, 1. And if it's very easy, you can do it on physio chair, arching your back, leaning forward. 3, 2, 1. Now that might be too hard for many people. You might be starting lower on the ground, or you can do it in sitting like this. 3, 2, 1. So just start at the right level for you. You certainly don't want to push that too hard. So this stretch is also for your piriformis muscle. Remember the one we brought over. 15% of people need to stretch their hip out like this to get a stretch. And again, I use the word stretch, but what I mean is soothing and getting flexibility rather than straining it out. Now, without putting a full stretch on my piriformis, this is a good position to just check whether I've got full agility and flexibility in my ankle. So I'm just gently twisting my foot up and looking to see how much of the sole of my foot I can see on this side, which gives a stretch to the outside, to the lateral side of my ankle. Up the other one goes, not too much of a stretch on my piriformis, just gently pulling the underside of my foot in, so I'm checking to see how much of my sole I can get with a stretch on the outside there. 3, 2, 1. That movement is so often lost. So everything tightens up on that side. It's not always indicative of a ligament problem, but it's certainly something that stiffens up very easily. I can also do a hamstring stretch in this position. I quite like it this way because you can do this if you're studying or whatever, just occasionally, just to give your hamstrings a bit of a stretch. And what's really important, again, just to remind you that you need to be able to have that full lock on your knee. So weight on the back of your heel, push the back of your knee down, use your quadriceps muscle to straighten it, and really feel that that's getting full elongation at the back there, a little bit of a strain perhaps on the knee, but nothing painful. And then on the other side, 3, 2, 1. Look at yourself sitting. Make sure you don't always sit to one side. Pull yourself up evenly. And that's a small thing, but an important thing. Okay, I hope these exercises help. Remember that they're more of an intermediate level. They're not a beginner. And if they were too hard, you go back to the video before this, my #1 video on hip, knee and ankle stability. Remember, you're going for quality and you're really trying to get those really small improvements in your stability that'll help you get the longer, harder game going. So take it slow, take it careful, avoid pain, and just gradually build up, maybe over a week, maybe 3, and then you might be ready for the next level.